Joseph Webb, CEO of Nashville General Hospital, speaks during an interview in his office at Nashville General Hospital in Nashville, Tennessee, Tuesday, December 12, 2017. Photo, Andrew Nels / The Tennessean, by photo. 3 years ago, Joseph Webb was hired to stabilize Nashville General, the city's safety net hospital for uninsured and indigent patients that has long struggled to pay its bills. He began with ambitious transformation plans: upgrade the emergency room, remodel the maternity ward, hire new administrators, and create a healthcare model intended to cut costs by focusing on managing diabetes, hypertension, and other chronic illnesses affecting the North Nashville community's residents who use the hospital the most. Today, Webb's future designs for the 125-year-old hospital are in question after Mayor Megan Barry announced plans to end all inpatient admissions, making the facility an outpatient-only clinic. Webb wasn't consulted about Barry's proposal, he said. Webb's contract expires January 4. It has yet to be renewed. A long-delayed review of his performance, due in February 2016, is now underway. On Wednesday, a newly released audit found that, under Webb, the hospital failed at basic bookkeeping, unable to keep track of patient payments and major expenses. Webb canceled an employee town hall meeting Thursday. On Friday, a specially called meeting by the hospital's board was hastily canceled hours before it was due to start. More, hospital landscape in limbo as questions swirl over Nashville General's fate. More, why the sheriff thinks Nashville General overhaul would cost his department $3.5 million. More, Nashville General board member resigns, mayor apologizes for surprise hospital announcement. Earlier last week, Webb, 63, chafed at the mayor's main talking points that the 9-story hospital is full of idle staff and empty beds subsidized by taxpayers. The mayor has pointedly highlighted the $26 million in emergency funding sought by Webb in the past 2 years, in addition to a $35 million annual subsidy from the Metro Council. Webb quibbles with the mayor's numbers. While the city has provided the hospital with $500 million since 2005, the hospital has provided $1 billion in charity care during that time, he said. Barry's oft-recited statistic that patients occupy only 44 of 114 beds in an average day is incorrect because the hospital has made many rooms private, leaving just 86 beds, he said. Beyond that dispute, Webb contends that hospital occupancy rate isn't the right measure for the continued need in Nashville for a safety net hospital, one that serves low-income and uninsured residents. Emergency room and inpatient admissions are down, in part, because the hospital is focused on preventative and ongoing treatment of chronic conditions, reducing the need for more expensive care, he said. If Nashville General is dismantled or diminished, its chronic disease model will no longer work, driving patients to the city's other emergency rooms and ultimately increasing the cost of care to the city. Barry has pledged to create an indigent care fund to pay the cost of care at other hospitals.